Hi, I'm Dr. Guruprasad, Senior Cardiologist and Electrophysiologist from Chennai. So let's know something about heart attack and what do you mean by loading doses and what do you mean by angioplasty. So what type of symptom, what type of problem can be heart attack? Suppose a person who is a diabetic, hypertensive, obesity, high cholesterol, a smoker, having sedentary life without much physical activity, having a lot of stressful jobs, they are known as risk factors for heart attack. So if a person with these risk factors, if one day if he has a problem like something happening in the chest, something burning, something that's crushing inside the chest, something that's heavy, a ton load that is put on the chest. So this is the feeling that if a person will get a heart attack. So this will be the presentation. Just like you can see this in this diagram. It's a diffuse central chest pain, diffuse central pain, just a crushing pain. And sometimes that may radiate, that may go back, that may come to this hand, and up to the neck. That may be associated with sweating and a fear of death and something that's happening really bad. So this can be really heart attack. So what may not be a heart attack? So something that after heavy eating with masala food and all, something that's come as a burp, something that's burning, and especially after heavy meals, and this can be a gas trouble, or sometimes just some movement, bending forward, backward, can worsen the chest pain, and just pressing here and there causing pain. They are not heart attacks. So a real heart attack will definitely tell you that something is going to be bad. And it's like choking. Actually, the typical feeling is that the patient will say crushing, something choking, that I'm unable to breathe because of pain, discomfort. It is more of discomfort, and with profuse sweating and fear of death. The person can feel something bad is going to happen, and believe this, and this can be a heart attack. And what you should do, and maybe if you are at home, and call somebody for help, inform ambulance, and alert your physician or go to nearby hospital. But meanwhile, you can just relax, or if you are caretaker, ask the patient to relax, give him fresh air, some water. And by chance, if you have some little medical knowledge, if you have aspirin tablets, give him 2 tablets of aspirin, 150 milligrams, that is 300 milligrams, and get an ambulance or bring the patient as soon as possible to a facility where there is a cardiologist, or at least a good physician who can evaluate the patient. Okay, what do you mean by loading doses? Usually the guidelines, international standard guidelines, say that any patient who comes with chest pain should be diagnosed within 10 minutes whether he has heart attack related pain or not. Within 10 minutes it should be confirmed. How do you do that? Just take an ECG. And if ECG can show a heart attack, definitely once it is confirmed by seeing a ECG that okay, this patient has heart attack, the drugs you give to the patient is known as, they are known as loading doses of the drug. The most important drugs we use is aspirin 300 milligrams, clopidogrel 300 milligrams. Nowadays we have good drugs, like prasugrel 40 milligrams and ticagrelor 180 milligrams. And of course, we combine these drugs, antiplatelets, with atorvastatin of 80 milligrams or rosuvastatin of 40 milligrams. So these antiplatelets and anti-cholesterol drugs, all combined and given at a time to the patient, this is known as loading dose. They prevent further complications. And exactly what happens in heart attack is, it's like an accident that happens inside the blood vessels of the heart. Heart is a good organ which has rich supply of the blood vessels, known as coronary arteries. If you can see in this picture, so they are the blood vessels inside the heart, known as coronary arteries. can see these yellow dots. They're all cholesterol plaques. They grow, and one day they block totally and they burst, and then the blood clots will form at that area. That is known as heart attack, in our medical terminology known as myocardial infarction. So this sudden cessation of the blood flow causing that produces the pain in the heart, so resulting in intense pain known as heart attack. So what do you do? It's like a mechanical problem causing something blocking the pipe. So we need to open it. It's like a pipe blocked in your kitchen sink pipe, something like that. So what does you call a plumber, take out the block and clear the vessel. Same thing what we do as a cardiologist. So after giving the loading doses, preliminary first aid, basic treatment, and if you have a facility, and refer to a patient to the cardiac center where there is a cath lab. So what we do, as soon as patient comes, ECG is taken, heart attack confirmed, all loading doses, important tablets are given, then immediately we inform the cath lab people to open up the lab, and we do by a small puncture, no surgery nowadays, it's just a small puncture. We take the pipeline, the catheters to see the pipelines, that is the coronary arteries of the heart, and we see where the block is, which pipeline, that is which coronary artery is blocked. And if there is a big block, usually we suck out the thrombus that is existing there, we known as thrombectomy, and still remaining blocks we clear it by putting a stent. This is known as primary angioplasty. So this is all like just like a plumbing work, and removing the blocks from the pipelines. So that's what we do in the cath lab. So if you have a confirmed heart attack, see a good physician or a cardiologist, get all medicines taken immediately. And then if you have a facility, we take the patient to the cath lab, open up the blocked vessel known as primary angioplasty. Sooner you do the procedure, and more lives you can save. So without much complications, without much damage to the heart, we can survive, hold the heart in toto, so that there won't be any dead tissue inside the heart. The whole life is back, and usually 90% of the lives we can give back normally. But still there may be some complications. We may lose 1 or 2 patients, but most of the patients nowadays can be saved with the modern available technology and medicines. Most of the lives we can save, really.